Hi everyone, so I'm going to be doing the concept notes for chapter 8 and 12, and it's policy practice and the social determinants of health. And I want to start by saying that we've seen that social workers have been shaping policies over centuries, right? So we know that they do, like the word says, social workers. They work for this is sociologic aspects, sorry, English, sociologic aspects of health in this case, and they are a key component of doing those policies that will impact directly to the health of everyone. Because if we go back to module 3, we know that medicine, like the sociology aspect of medicine transitioning through education, and having medical medicine be licensed, was established in the 20th centuries with the same, goal of like making things, instead of to people herited the gift of healing, to make it an education and then make it insurance, some follow-up, some guidelines and regulations for the safety of the people. So we know that since then, sociology, it's a key component of the healthcare, right? So health is not just medicine. We can see that it's influenced by biology, and like in that case, microbiology, physics, and all that. And then the psychology and the sociology, definitely. So we saw some terms like policy practice, that is using the social work skills to create change and improve policies, promoting that that it's fair for all, and there's equity in it, right? That's the ideal part. Work at any level, local, states, federal, and once again ensures that there's equal opportunities for everyone. Historically speaking, we just we can remember that social workers actually fought for children labor laws and other working conditions for the better of society. And today, that's definitely like the mission, right? Social workers are part of the team of healthcare in order to like have better outcomes and once again make it fair for everyone. The policy practice we saw analyzing problems, advocating for those changing, and empowering communities. There's some key steps or stages of policy practice or promoting a new policy. And this part right here kind of took me back to a little project that I was trying to work last semester, that I probably will take back, about nursing in Puerto Rico, nurses in Puerto Rico. And I want to like make it as an example that I identify a problem in which, and even here in a lot of states, when I start doing the research, the ratios of patient to nurse, that's not a law. It's only like in California, and I think in another area, but in the US, it's only California that they have like an actual government. I mean, their state has a regulation for ratios, but that's something that is not seen in other states. So in my case, this is me just being curious. I did not know that this was like social worker or sociology. That was like when I started working on that, and I realized the professor that I'm working with, he has a sociology in healthcare. So that's how I started connecting the dots, right? I had a whole complete different concept of what the social worker does, or the function overall. So definitely that experience and this class is helping me to like put the right pieces together, and not the things that I had in my head. But once again, it's just like identifying that problem, gather the evidence, and then trying to communicate and motivate others in order to have that policy, take place and take relevance, and people get involved to it and make it an actual an actual change to advocate. Because once again, we probably can remember from previous, like in the mental health tab, that it was like a lot of the things were pushed because the direct connection with Kennedy and his sister. So like in order for you to, as a social worker, probably to like make something really get to bigger groups to agree with you, you definitely need to make it, as personal as possible, and you need to make a good communication and motivate others of like, why is that important, and why is that relevant to healthcare, and to society. It's for the better of society. And throughout the information, research shows that simply expanding medical care doesn't guarantee healthier populations. Like, there's nutrition, there's income, there's education, public health efforts, social support as like your support group, and so on. That has a big impact on how your health, it's like anyone's health is going to improve, or not have a lot of improvement, not medicine alone. And here, a good example, I had the experience to work in Nemours, and one of the things that you will see in the chart, that was like a very unique chart. I don't know if like anyone that has Epic, it shows like that, but it has the little map. I forgot the name. We saw that in a previous chapter, but it has the map that like the health is just a piece of the pie. But there's like this, like if the person, is facing some sociological challenges, like they have their both parents, their parents are employed or not. Is there an income? Do they have a household? Is it a shelter kid? Or if it's, it looks like a little pie, and all of those, like the nutrition, if that patient is actually eating right, if they're getting their education, and they have all of those resources for chronic kids in the hospital, so they have a big picture of like the overall health. And we know that definitely is a work from social workers and people like those that are encouraging that it's not only just the best medication or the best equipment for the treatment, but we also need to make sure that everything else, because by the time they're discharged, they're probably going to go back to the hospital because they're not having all of the other parts met. Inequality definitely plays a big role. We know it's like, we also have read multiple times that there's a correlation with chronic illnesses and lower incomes, as well as if populations lack of access based on their race, like African Americans, Hispanic, especially immigrants, with all this citizenship issue, and then definitely that large gap, it's giving like some higher rates of illness and mortality. God, English. So definitely the role of social work and public health in professionals, applies that psychosocial aspect of it, like just not the medicine, but everything else that could some sort of impact that outcome, right? And once again, to improve the U.S. healthcare, we must just go beyond medicine and the hospital. So it's a lot more than just knowing the care plan, right? Like, it's not only the care, like, does the patient has the capacity to follow that care plan when they go home? Are they able to have that support system that will make them, comply to that care plan that the doctor or the provider gave? Those are gaps that the doctor has no time to take care of. Nurses and all that, they do their best, but like the social worker is that big major piece when like all of everything in like medicine is being taken care of. We need to make sure that person has where to sleep, if they're eating, if they have clothing, if they like all of those little things that add up and definitely can make a huge impact. And at the same time, also, once again, the policy making aspect of it. We want to make sure that the policies are being, make to make a better society, and they're monitor and they're being, making sure that hospitals or our providers or so are compliant to those policies, and then over time making sure those policies are actually working. And that's an action that definitely can change people's life. So that's concept notes for chapter 8 and 12. Hopefully I tried to make it short, but yeah. Thank you.